Hi friends, in this lecture we'll study a very important topic, that is the anatomy of the cecum. So in this picture you can see the cecum. There is the cecum here, and here also you can see this is the cecum. Okay, so the cecum is said to be a large blind sac forming the commencement of large gut. So this will be the indication of the commencement of the large gut, the beginning of the large gut, and forms an asymmetric sac furnished with tinea coli. So there is a asymmetrical sac. So it's a asymmetrical sac, means there is no symmetry between the two sides. If you see, so it is not symmetrical but asymmetrical. This side, the right side part, is larger compared to the left side part. So that's why it is said to be asymmetrical sac furnished with tinea coli. These are one of the important indication that this is the large intestine. So this cecum is a large blind sac commencing the commencement of the indicating the commencement of the large gut, and forms a asymmetric sac furnished with tinea coli. Situation: it is present in the right iliac fossa. This is the iliac fossa, and within the right iliac fossa it will be present. And it is above the lateral half of the inguinal ligament. Inguinal ligament, as you know, it's a ligament extending from the anterior superior iliac spine to the pubic tubercle. So it is present, this, if you think this is the inguinal ligament, so it is present in the lateral half of the inguinal ligament, above the lateral half of the inguinal ligament. The length is of this cecum is almost 6 centimeters in length, but the breadth is 7.5 centimeters. Usually the length, whenever we say length, it should be higher, but this is one of the organs which will have the length shorter than compared to the breadth. The other organ will be the prostate with a greater breadth than the length. Okay, or the width is much more compared to the length itself. So the length is 6 centimeters and the breadth is 7.5 centimeters. This is cecum. And as I said, the shape is asymmetrical. Okay, so there is no symmetry between the two sides. So this is the cecum. Here again you can see with the tinea coli in the front. Types: what are the types? There are different types. The first one is called as the fetal type, also called as conical type. It looks like a cone of an ice cream, so that's why it is called as conical. Sometimes it will be, instead of this shape, it will be like a cone with the appendix coming from the center. This is almost present in 2% of the cases where it is called as fetal type or the conical type, because it is still in the development of the cecum itself. The second type is called an infantile type or intermediate type, which is present in almost 3% of the cases. The normal type is what you see here, the adult type, or it is also called as the ampullary type, where it is present in almost 90% of the cases. It will be ampullary type, this type. Okay, adult type. Where the right secule is larger compared to the left secule, and the appendix is almost 2 centimeters below the ileocecal junction. This is the junction where the small intestine open into the large intestine. The ileum will be open into the cecum. That's why it is called as the ileocecal junction. So this appendix will be almost 2 centimeters below the ileocecal junction. So this is the normal type, or called as the ampullary type, present in almost 90% of the all the people around the world. In some, it is called an exaggerated type, where it is almost in 4 to 5% of the cases, and the appendix is close to the ileocecal junction, where the appendix is close to the I said it is almost 2 centimeters below the ileocecal junction, but if it is less than that, less than 2 centimeters, then it is called an exaggerated type, which is present in almost 4 to 5% of the cases, where the appendix is very close to the ileocecal junction. Okay, so these are the 4 types of the cecum. One is called as the fetal type, or also called as the conical type. The second is the infantile type, or also called as the intermediate type. The third is the normal type, which is also called the adult type or ampullary type, which is present in almost 90% of the cases. And the fourth is called as the exaggerated type. Okay. Now coming to the abnormal positions and the development of the cecum itself. Depending on the development, there are different abnormal positions where the cecum might be found. Okay, so these are all the sites where the cecum can be found. Okay, it can be present in the left iliac fossa. This can be present in the left iliac instead of on the right side. It can be on the left side in the left iliac fossa. Then the second is near the umbilicus. Near the umbilicus, it might be present in near the umbilicus. The third is it can be below the liver. It is called as subhepatic. Just below the liver, it can be present. That is called as the subhepatic type. The fourth is the right lumbar. Instead of in the higher position, it can be very much low into the lumbar region. So that is called as the right lumbar type. And the fifth is present in the, it might be present in the pouch of Douglas. So as you know, during the development of the gut itself, there is a condition called as the rotation of the gut. So if you see here, this is the gut during the development. This is the foregut here, this is the midgut, and you can see and this is the hindgut. So during rotation, you can see in the midgut, you can see the cecum. So during rotation, if you see here, the cecum keeps seeing, so it keeps changing the position because of the rotation of the gut itself. So it will be moving in different positions. So depending on where it moves, this now it is in the subhepatic type. If it remains as such, then in the adult case, then it is called a subhepatic. Now it has gone very much below into the lumbar region. So if it remains as such, even in case of the adults, then it becomes the lumbar type. Okay, and this is the normal position. When it comes back to its normal position finally, after all the rotations, it will come back to its normal position. This is the normal position of the cecum. So if it is incompletely developed or the rotation is incomplete, then it leads to different abnormal positions of the cecum itself. Now coming to the topography of the cecum. Cecum occupies a triangular area here. If you see here, there is a triangular area which is formed above by the transtubercular plane, the two tubercles of the iliac crust, where the horizontal line is drawn joining the two the tubercles of the iliac crust. Then it is called as the transtubercular plane. On the above, there will be transtubercular plane. Below, by the fold of the groin, or it is also by the inguinal ligament itself. The fold of the groin is just near the inguinal ligament. And medially by the right lateral plane. This is the right lateral plane. Okay, this is the left lateral plane, this is the right lateral plane, or it is also called as the mid-clavicular plane. Okay, or it is also called as the mid-inguinal line. Okay, so this is the on the medial side. Above we have the transtubercular plane, below we have the fold of the groin or the inguinal ligament, and medially we have the right lateral plane. Okay. Coming to the peritoneal relations, you should know that the whole of the cecum is covered by peritoneum. So cecum is covered by all sides by the peritoneum. So this is the rule. Okay. So here you can see again the position of the cecum. Usually it will present in the below the transtubercular plane. This is the transtubercular plane, right lateral plane, and here is the inguinal ligament. Coming to some important general relations. This is the cecum here. Okay, so in the front, anteriorly we have the anti-abdominal wall itself. Then we have the greater omentum. In the previous pictures you saw during development. So there was the greater omentum. This is the greater omentum. Okay, so this greater omentum, cecum will be there. In the anteriorly we have the anterior wall. Then we have the greater omentum. Okay, then we have the coils of the intestine itself, especially the small intestine. The coils of the small intestine will be covering anteriorly. So these are the structures in the which form the anterior relation: anti-abdominal wall itself, the greater omentum, as well as the coils of the small intestine. Behind it will be the right iliopsoas muscle. So if you see here, this is the iliacus muscle, and here this is the psoas major muscle. Together they are called as iliopsoas, which will be present behind in the right iliac fossa. Okay, so behind it will be the right iliopsoas muscle. Then there will be femoral nerve which will be running downwards, as well as the genitofemoral nerve also running downwards. All these are behind posterior relations of the cecum. Above, this will continue as the ascending colon. This is the transverse colon which is cut, then descending colon. So this is the beginning of the large intestine or the colon. So it continues after cecum, it continues as the ascending colon. Below we have the lateral half of the inguinal ligament. We already saw this, the inguinal ligament. Okay, so the lateral half of the inguinal ligament will be below. Okay. And medially we have the ileum as well as the vermiform appendix. So here on the medial side we have the ileocecal junction as well as the ileum here, and the appendix which will be medially present. So these are some of the important relations of the cecum. Coming to the some histological features, just like the other parts of the intestine, this will also have the four layers: the mucosa, submucosa, muscularis externa and serosa. We will not go into details because that will be covered in the histology lecture. So the innermost lining of the epithelium is by the simple columnar with numerous goblets and devoid of villi. So this differentiates the ileum, where there will be villi present. Some villi will be present, as well as a few goblet cells are there, but here there will be huge number of goblet cells, okay, and devoid of villi, and it is lined by simple columnar epithelium. Then the muscular cord, it will have the outer longitudinal layer which will form tinea coli in case of the large intestine. Okay, in the small intestine they will be totally covering the whole of the small intestine, but in case of large intestine they are condensed into three regions. They form the tinea coli. Okay, so the tinea coli are of three types. Three are there and they are named, okay, according to their position. The tinea coli which is in the front, that will be called as the tinea labra, or it is also called as the free tinea, which is in the front. Then we have the tinea mesocolica, or it is also called as the posteromedial. Okay, so here if you see here they are pulling this, so you can see the mesocolic tinea, okay, exposed by the hook. So they are pulling by the hook so that you can see the mesocolic tinea, okay, or it is also called as tinea mesocolica, which is present posteromedially. Then we have the last one, that is the tinea ommentalis. So here you can see this, the tinea ommentalis, or it is also called as the omental tinea, which is present posterolaterally. Okay, so these are the three tinea which will be present in the large intestine. So because it is present in throughout the large intestine, so it is also present in the tinea, in the cecum. So all these three tinea will come and join at the root of the appendix. So if you want to trace the appendix, trace one of the tinea and go all the way downwards, and finally when it reaches when at the junction of all the meeting of the three tinea, you can trace the appendix. Now coming to the internal features of the cecum shows two orifices. The first one is called as ileocecal orifice, which is present on the posteromedial wall, and it is at the junction of the transtubercular and the right lateral plane, and it is guarded by two lips, one upper one called the horizontal lip and the lower which is concave. The upper will be horizontal, lower will be concave. So this is the ileocecal orifice, which is guarded by guarded by valve, which is consisting of two lips, the horizontal and the concave. The second orifice is the appendicular orifice, which is almost 2 centimeters below the first one, ileocecal orifice. Okay, and it is behind the ileocecal junction. Okay, so almost 2 centimeters below there is second orifice. This is the appendicular orifice. This is the first orifice, ileocecal orifice, with the two lips. Upper one is the horizontal lip and the lower one is the concave lip. Okay, and the second is the appendicular orifice, almost 2 centimeters below the ileocecal junction. And this is guarded by a valve called as the valve of Gerlach. So these are the two orifices which we can see when we cut open the cecum and see inside of the wall of this cecum. So here you can see ileocecal orifice as well as the appendicular orifice. Here also you can see the same thing. Okay. So here also you can see the papillar form of the ileocecal sphincter. This is the sphincter. This is just to show how the sphincter is formed. This is the ileum and this is the cecum. So here is the ileocecal orifice which has a sphincter like structure which pushes the food particles and whenever it wants it can retain within the small intestine. So there is a sphincter at the ileocecal orifice. Arterial supply is by the anterior and posterior cecal branches of the inferior division of the ileocolic artery. So here is the inferior-colic artery, the ileocolic artery inferior. So this is the superior and this is the inferior. So inferior ileocolic artery which will be giving branches which will be called as the anterior cecal, and then there is a branch called as the posterior cecal. So these are two branches from the ileocolic artery, the inferior division. Okay, the anterior branches reaches the cecum via the ileocecal fold. So the anterior cecal artery which will be reaching the cecum via the superior ileocecal fold, and the posterior branch along with supplying the cecum, it also supplies the base of the appendix itself. It also supplies the base of the appendix. This is the posterior cecal artery. Okay, or it is also called as the posterior branch of the ileocolic artery. Okay, so here also you can see this is the ileocolic artery, and here it is coming the inferior division which gives two branches, anterior cecal artery which supply the anterior surface of the cecum, and the posterior cecal which also supply the posterior surface as well as even the root of the appendix. Coming to the venous drainage is similar to that of the arterial supply with the similar veins, ileocecal veins which will be anterior branch and posterior branch which will be draining into the ileocecal veins and from there into the superior mesenteric vein. Okay. Coming to the nerve supply is by the sympathetic as well as the parasympathetic. The sympathetic is by the superior mesenteric plexus from the division of the T10 to L1 which will be supplying the cecum, and the parasympathetic is by both the vagi. Okay, both the vagi. Coming to the lymphatic drainage will be to the ileocolic lymph nodes which will be in turn draining into the superior mesenteric group of pre-aortic lymph nodes. Okay, so it will be initially draining into the ileocolic lymph nodes and from there to the superior mesenteric group of pre-aortic group of lymph nodes. Coming to the last part, that is the applied aspect or the clinical aspect or the clinical anatomy. So this cecum acts as a guide for the intestinal obstruction. This is the guide which will be the common site for the intestinal obstruction. This is also the site of the amoebic dysentery as well as the intussusception. So this is the intussusception where a part of the intestine passes into the other part. If you see here, so one part of the intestine is invaginating into the other part which leads to the intestinal obstruction. So here you can see the normal intestine, the wall is smooth, but in case of intussusception a part of the wall becomes weak and it invaginates to the other part. Okay, so this is called as the intussusception. So here also you can see this is a very common site for the intussusception. So there is incision taken to correct this intussusception. So here you can see at the cecum, ileocecal junction, you can see this the intussusception happening. Okay, so this is all about the CECUM. If you have any doubts, you can write to me and I will try to answer. These are my references. Thank you very much. Hi friends, if you like my video and if you want to see similar kind of videos in the future, subscribe to my channel as well as like the video. Press the bell icon so that you can get regular updates and you will be the first to get the updates. then you can also comment as well as share this video with all your friends so that all can benefit from this. Thank you very much.